I'm Brian Pierce, Vice President of Clinical Services and Provider Management at MedRisk. I'm a physical therapist, and this is your Clinical Minute. So one of the most important parts of managing someone's recovery is managing their expectations. A group of researchers asked people what their expectations for recovery would be given a certain hypothetical scenario. So imagine you've had back pain for 3 days across both sides of your back, probably as a result of having lifted some boxes. You see a provider, they do a very thorough exam, and they tell you 3 things. 1, your outlook for recovery is really good. 2, movement should help your condition. And 3, the sooner you get back to normal activity and work, the sooner you will get better. So given this scenario, how optimistic would you be about your recovery? So here was the cool part of this study. They gave different subjects different hypothetical diagnoses. They were told, you have one of these 6 diagnoses. So I'll ask you, does some of these sound more threatening to you than others? Well, in this study, the diagnostic label that was used seemed to make a really big difference. So the top 3 on this list, those patients seemed really optimistic with really high expectations for recovery. And the bottom 3, they had greater concerns about the need for things like a second opinion, imagery, and even surgery. So the lesson here is that labels, particularly with back pain, really do matter. And 2 patients with the same injury, given the same prognosis, may have very different expectations. So managing expectations is really important, but sometimes recalibrating those expectations is even more important.